In this video, we're going to be discussing the exact meaning of SOAP notes, also known as SOAP charting. SOAP notes are a standard format used by numerous healthcare providers to chart information about the treatment of their clients. The acronym SOAP means subjective, objective, assessment, and application, and then planning. This is what we are going to be covering today and how it applies to the field of massage therapy. So if you are a massage therapy student studying for the MBLEx or a massage therapist wanting to learn more about SOAP notes, this video is for you. So let's go ahead and dive into this material. The very first one we have is subjective. This is any information that the client provides to the practitioner. This information may be directly from the client's intake form, information gathered during the initial consultation, during the massage therapy treatment itself, and even after the massage is complete. Anything that is subjective is based on feelings or personal opinions. Now, it's important to remember the key word here is feelings. Often clients will tell us that their neck or back has been in a great deal of pain for the past week. This is known as the client's chief complaint. Chief complaint is often abbreviated on the SOAP notes as CC. This allows the therapist to save time when documenting by hand. Just make sure you are being consistent when doing so. Now, the client's chief complaint is information that is based on the client's personal experience of pain, meaning this is information that the client can only relay to the massage practitioner, not necessarily prove. This type of information would go in the subjective portion of our client's SOAP notes. For example, subjective information would include health history. It is common practice for massage therapists to have a client fill out intake forms prior to the client's massage therapy treatment. This gives the therapist the opportunity to quickly go over the client's health history to make sure the client is safe for massage therapy services. In other words, does the client have any conditions that may contraindicate massage therapy services? Anything that is checked off on the intake form would be considered subjective information. This is written information that is being shared with the therapist. It's important that I note this as well. It isn't uncommon for a client to verbally share information related to their health history. This is often information that is shared during the actual treatment itself. For example, I've had clients remember something they forgot to mention prior to the session, such as a cortisone injection that they received in their elbow for pain. The client mentioned this as I was approaching the area during the massage. Now, this is information that I want to add to my client's SOAP notes after I complete the treatment. I would encourage you to write any information that the client tells you in direct quotations. As stated by the client, I had a cortisone injection in my right elbow. Please be careful with that area. You would then document how you treated this area. For example, client had an adhesive bandage over their right elbow. I avoided this area for the massage therapy treatment. Another subjective piece of information is a client's current medications. Medication type, frequency, timing, and any side effects. Now, I understand that for most massage therapists, medications can be scary, especially when we do not understand some of the confusing names. I tell my students it is good practice to research the client's medication or even ask the client about them. The client is a good source of information when it comes to the medications they take. Our main concern for medication in the practice of massage therapy is whether the medication will affect the treatment itself. For example, let's say we have a client come in with pain in their lumbar region and they list tramadol on their current medications. You ask the client when they last took their medication and they inform you that they took their prescribed medication an hour and a half prior to coming into their appointment. Because tramadol treats moderate to severe pain and is an analgesic medication, this medicine acts on the central nervous system by inhibiting the transmission of pain. It is likely that the client will not be able to gauge your pressure correctly because the medication is affecting the client's sensory neurons. Knowing this information helps us adapt to the client's circumstances. In this example, the client would still be safe to receive massage therapy treatment. However, we may need to adjust our pressure not to overwork the client's tissues because they do not have the ability to give us proper feedback. We may also need to remind the client when they ask for more pressure that their medication may be causing an altered perception of the pressure. Areas of concern are oftentimes the primary reason a client is seeking massage therapy services. Pain is another subjective piece of information. We want to listen to our client's SOAP notes. Pain is oftentimes abbreviated on SOAP notes with a capital P circled. In the SOAP notes, we want to chart the onset of the pain. When did the pain begin? This helps us understand what may have caused the pain. Perhaps an older client with pain in their lumbar region noticed the onset of their pain after gardening over the weekend. The location of the pain. Where is the pain located? In this case, our client's pain is in the lumbar region. Does the pain radiate anywhere else or does it stay in one location? Type of pain. What is the client experiencing? Does the client characterize the pain as dull, achy, stabbing, sharp, shooting? Perhaps maybe the client is even experiencing numbness. The duration of the pain. What is the frequency of the pain? How often does the pain last? ADLs that aggravate the pain. ADL is an acronym meaning activities of daily living. This is another acronym healthcare professionals use to save time when charting their clients' SOAP notes. ADLs are the activities necessary for daily living, such as cooking, cleaning, bathing, brushing your hair, etc. For example, shoulder pain with ADLs. Client has right-sided weakness from a stroke and is not able to lift her dominant arm to brush her hair, would be considered subjective information that we would need to chart in the subjective section of our client's SOAP notes. ADLs that alleviate the pain. For example, client with lower lumbar pain mentions they must lie down and place a pillow underneath their knees to take the pressure off their back, and this helps reduce the pain in their back when going to sleep. This would be considered activities of daily living that would alleviate the pain. A very helpful tool that we can use in our intake forms is a subjective pain scale, where we ask our clients to describe the level of pain they are experiencing by using a pain scale, 0 being no pain at all, 10 being excruciating pain. Another helpful tool is a body diagram. Often these diagrams have an anterior, posterior, and even a lateral view of the body, so that the client can identify any areas by circling, shading, or placing an X on these areas that are their main concern. This gives the client the ability to show you exactly where the pain is. Another subjective piece of information would be areas to avoid. I would argue that this is one of the most important pieces of information on the client's intake form for massage therapists. Why? Because when a client lists an area to be avoided, this means that they are setting a boundary. They are saying, I do not want you to massage my glutes, or I do not want you to massage my scalp, or I do not want you to massage my feet. It's very important that we respect our clients' boundaries, and it is also important that we remember these areas going into the treatment session. We do not want to unintentionally cross a client's boundary by accidentally massaging the area they specifically told us not to massage, and we never want to violate a client's boundary. To learn more about the differences between boundary crossings and boundary violations, click on the link above and check that video out, but be sure to come back and finish the rest of this lecture as well. All right. In addition, we need to make sure that during subsequent treatments, we are asking our clients if they still want these areas to be avoided. This gives the client the opportunity to decide whether they want to change or add any other areas to be avoided. Make sure that you check with your state or local massage therapy governing boards. In my state, if there are any changes to the client's reason for seeking massage, including areas to be avoided, the client will need to complete an updated intake form. Again, make sure you are checking with your massage therapy rules and regulations and that you are following these rules. Any current or past injuries. This information gives us the ability to make sure that the client is safe for massage therapy services. I ask all of my students, what is the most important principle when it comes to massage therapy? Often the students will reply, respect, which yes, they are correct. I drilled this principle on the very first day of class, so I appreciate that the students respond with this answer. Yet, besides respect for our clients, the single most important rule for massage therapy in any other industry out there is safety. We need to ask ourselves, before we treat every one of our clients, is this client safe for massage therapy services? If the answer is yes, continue with the treatment. If the answer is no, or perhaps there is uncertainty or doubt, we need to tactfully refer our client to their primary care physician for a proper diagnosis. For example, let's say a client comes in on a Saturday for a massage because they are having severe pain in their cervical region. After inquiring on what might have caused the pain, the client informs you that they had a motor vehicle accident on Monday. With this information, we have the ability to make an informed decision based on the evidence given to us that the client is likely not safe for massage therapy services, at least until the client seeks medical attention for this severe pain they are experiencing and receive a proper diagnosis. Current or past surgeries. Again, we need to ask ourselves, is this client safe for massage therapy services? If the client received any current surgeries, we need to ask our clients, has your surgeon released you for massage therapy services? If the answer is yes, we need to be sure to write in our SOAP notes what was stated by the client. For example, as stated by the client, yes, my doctor released me 6 weeks after surgery with no restrictions. You will also want to make sure that you note the date of the surgery. Now, if the client says no, Again, you will want to tactfully ask the client to be sure to have their surgeon give them the okay for massage therapy services. Client expectations and goals. I make it a habit to ask my clients what their goal is before each massage therapy treatment. This is a good idea to get in the habit of, and I would encourage you to do the same if you do not already. The reason for this is when we ask our clients what their goal is, it gives us the exact reason the client is seeking our services today. If they mention they want a very relaxing massage, that they've had a stressful week, then we know exactly what the client is requesting. This gives us the opportunity to plan a treatment around the client's expectations for the massage therapy services. It is now the massage therapist's responsibility to do their very best to give the client a very relaxing massage. Another goal a client might have is working toward having the ability to lift their right arm high enough to turn on the light switch at home, such as in the case earlier of the individual with right-sided weakness due to a stroke earlier in their life. Client goals and expectations are a subjective piece of information because this is information that the client can only express to us. It is based solely on personal goals and expectations for the massage therapy services. Any preferences, such as what is the type of music the client requested? If the client requested a blanket, if the client requested to leave her socks on during the treatment, if the client requested a certain technique, if the client requested more or less pressure, any information that you feel would be important for you to review prior to treating the client again, or if another therapist is treating the client. Again, the subjective portion of the client's SOAP notes is anything the client tells the therapist that the therapist considers to be important for therapeutic purposes. One more example of subjective information a client could tell the therapist that would benefit the therapeutic relationship would be the client's occupation. If the therapist knows the client is a truck driver, this gives the therapist the ability to create a treatment plan that will target the muscles that become affected by sitting over an extended period of time. The muscles that are affected by sitting over an extended period of time are the client's compensation patterns. For example, we could expect the client's muscles to compensate by lengthening the back muscles and shortening the chest and abdominals, since the client is always in a seated position while working. Now, moving on to objective, this is any information that the therapist gathers about the client. This information can be gathered during the initial consultation, during the actual treatment itself, or during client pre or post assessments. Anything that is objective is based on facts. Facts is the key word here. This is evidence-based information that is acquired during the client's visit. For example, objective information would include accommodations, any modifications that the client may have needed for the massage therapy treatment. If a client comes in with a walker and needed help opening the door, or if the client needed help getting on and off the table, these are accommodations that you want to list in the objective portion of the SOAP notes. For example, in my professional practice, I've treated a client who needed assistance getting on the table, as well as turning prone for the massage. The client was not able to breathe during the massage while they were face down within the face cradle. I assisted the client back up to a seated position and off the table. We then attempted a massage chair. The client was not comfortable in the massage chair either, since the client kept sliding forward. We finally decided just to do the massage in a regular chair, and this modification worked out perfectly. The client was happy that I was able to still accommodate with the massage in a position that they were comfortable in. This is all information that I listed in the objective portion of my client's SOAP notes. I also recommended that the client be a one-on-one with me since I was familiar with their treatment. However, if the client were to see another massage therapist in the establishment, the treating massage therapist would be able to read the client's SOAP notes and understand exactly the accommodations that were necessary to treat this client. Another accommodation that a client often needs in a massage therapy setting is bolstering and positioning. Oftentimes, a client may request additional bolstering that may help alleviate any discomfort they feel. Women will often ask for a chest bolster if they have larger breasts to take some of the pressure off this area when lying down in the prone position. Or clients may ask for a pillow underneath the pelvic region while they are in the prone position to take some of the pressure off their back. This is information you want to list in the objective portion of the client's SOAP notes, so that when you or another therapist works with this client, you are able to accommodate the client again, or ask the client if they would like the same bolstering and positioning. Visual assessments. Any visual assessment that can be made about the client visually. In other words, what the therapist sees. For example, if the client has a shuffling gait or left or right-sided weakness, or they may come in for their treatment with a walker or a cane, this is information we would want to document in the objective portion of our SOAP notes, especially if the client needed any assistance such as opening the door for them, helping them on and off the treatment table, or assisting the client with dressing before and after the massage therapy treatment. Another visual assessment is assessing the client's posture. Perhaps the client has a forward head posture as they are standing upright, or perhaps the client has an excessive rounding of their upper back as the client is sitting. Visual assessments are objective information that the therapist would want to chart in the client's SOAP notes. This information gives the therapist the ability to create a treatment plan that will help target the muscles that have been shortened and lengthened over time. Another visual assessment a massage therapist has the ability to recognize is any changes in our client's skin. Now, it is essential that we understand the acronym ABCDE, which characterizes the signs of skin cancer in moles or skin lesions. You also need to make sure you know this information for the MBLEx. If I oversaw the creation of this exam, I would have a question or two concerning this material. This is how important I believe this is. A stands for asymmetry. This is the difference in sides. One side appears different than the other. B stands for border. The outer edges are uneven. C is for color. There are multiple colors such as black, blue, brown, red, white, etc. D is for diameter. Larger than a pencil eraser, although I have read that doctors are finding skin cancers of smaller sizes. And then E is evolving. The mole or skin lesion is changing. I have also read the acronym E as elevation, meaning that the mole is lifted up off the skin. I would highly encourage you to make sure you know this information. It is best practice to bring any concerns to the client's attention after the massage. We do not want our clients to worry during the massage, but we also want to let them know. So it is best to let them know afterwards. And we never want to tell them that it may be skin cancer. We just want to let our clients know that we notice some changes in their skin and encourage our clients to seek a medical exam of their skin by their primary care physician or their dermatologist. Palpable assessments are any palpable findings in the tissues and skin of the client. Palpable is a term meaning touched or felt. In other words, what does the therapist feel? This is by far one of the most important assessment tools for massage therapists because we are in constant contact with our client's body. For example, if a client has a tightened area in and around their rhomboids that is giving the client problems, this is information that we would want to chart in the objective portion of their SOAP notes, especially when it can be identified with palpation. Same client. Let's say that we are treating this area with some deep cross fiber techniques. When suddenly we hit a spot and the client says, "That's the spot right there." This spot is what we would identify as a trigger point, meaning that when palpated, the client had a response of pain. This point literally triggered pain, hence trigger point. Now, keep in mind that not all pain responses may be trigger points. It is important for massage therapists to understand the gross anatomy of the skeletal system and any underlying structures. We could just be brushing the tissues over a bony projection, which would then elicit pain from the client. For example, the area over the superior angle of the scapula. If we are massaging and are not aware of this bony projection underneath, we may believe it to be a knot, when in reality, it is a bony projection of the client's scapula. And of course, it would elicit pain since we are applying pressure to the tissues against the client's bone. Therefore, it is important for massage therapists to understand the underlying structures of the skeletal system. However, if we are in a spot that is just muscle tissue, then this spot may very well be a trigger point that we would want to list in the objective portion of our client's SOAP notes. With this information, the therapist can then describe the therapeutic treatment used to treat the trigger point. However, the application of this treatment would then be described in the assessment and/or application portion of our client's SOAP notes. I want to note something very important here about visual and palpable assessments before we move on. Massage therapists have an advantage that many other healthcare professionals do not. I do not know of very many healthcare professionals that are in constant contact with their client's entire body. Massage therapists oftentimes massage the client's entire body for an hour or more. There's a quick story I want to share regarding this. I had a student tell me that their massage therapist saved their life. The student was receiving a massage, and afterwards the therapist mentioned they felt lumps. The student explained that they had already been to the doctor to have it checked out, and the doctor said it was not anything to worry about. It was likely calcium deposits. The therapist kindly said, "I think you should get a second opinion just to be safe." When the student went to get a second opinion, the student was diagnosed with lymphoma. The student is now in remission and is on their way to becoming a massage therapist themselves. Massage therapists have the ability to identify any abnormalities in their client's tissues simply by touch or visual assessment. We must do this tactfully. We should never diagnose a client or attempt to scare them. We should only encourage them to seek medical attention for any abnormalities we may visually assess or assess through palpation. Any results, such as the results gathered during range of motion assessments, such as active range of motion, passive range of motion, and resisted range of motion, also known as muscle testing. If you need a refresher on the differences between AROM, PROM, or RROM, I would encourage you to watch the video where I cover the differences between the three. Click on the link above to watch this video. Just make sure you come back and finish the rest of this lecture. Now, perhaps the client is not able to fully abduct the right shoulder more than 90 degrees without pain during active range of motion as a result of the stroke they suffered years back. This is information you would want to chart in the objective portion of the client's SOAP notes. Furthermore, if during range of motion testing, when you assess the client's passive range of motion, you were able to passively abduct the shoulder through its full range of motion, this is also information you would want to insert in the objective portion of the client's SOAP notes. It's also important that we compare the client's results bilaterally, meaning that we assess both the right and the left shoulder joints. This way we have a baseline of the client's normal range of motion on the left shoulder, since the client has right-sided weakness. In other cases, if the client is not able to compare bilaterally, such as bending over to touch their toes, you can then compare your client's current state of range of motion to their prior state of range of motion before any dysfunction. You would simply ask the client what their previous ability was when bending over to touch their toes. Next, we have assessment or application. In this portion of the SOAP notes, this is where the massage therapist charts information of the treatment that took place during the massage therapy services. In other words, what treatment was applied. The reason for application in lieu of assessment is it is not within the scope of practice for a massage therapist to diagnose a client. As I mentioned earlier, many healthcare professionals use SOAP notes to chart patient information, so assessment is commonly used to diagnose a patient. After gathering all the subjective and objective evidence, a conclusion is made, arriving to a diagnosis. Since massage therapists do not diagnose their clients, rather, we use this assessment portion of our SOAP notes to describe what took place during the treatment, hence application. It's important that I mention we must be very careful when it comes to assessing our clients' dysfunctions. Even when we believe we may know what is going on, we need to make sure we do not mistakenly diagnose a client. This is not within our scope of practice. We must be very careful with what we say and how we chart any information in our client's SOAP notes. Stay away from diagnostic terms. For example, in my professional practice as a massage therapist, I have run across client SOAP notes with documentation from a former massage therapist who had worked on the client before I had. As I went over the client's SOAP notes, I noticed the former therapist documented that the client had frozen shoulder. As I was conducting my initial consultation with the client, I inquired about the client's shoulder. The client mentioned that they had always had problems with their shoulder, such as stiffness and pain. I asked if the client had been to a doctor for a proper diagnosis. The client said no. I went as far as to ask the client if they had told their former therapist that they believed it may have been frozen shoulder. Again, the client said no. The former therapist was not within the scope of the massage therapy practice. Now, in defense of the former massage therapist, they may have believed frozen shoulder was a common term used for shoulder dysfunction. Almost like sciatica is commonly used to describe any pain felt in the buttocks and leg. As massage therapists, we still must be very careful that we are not diagnosing our clients or telling them, you know, that sounds like you have frozen shoulder, or that pain you're describing is most likely sciatica problems. This is still considered diagnosing. All we should be doing as a massage therapist is charting what our clients tell us and encouraging our clients to have their conditions checked out by their primary care physicians. That doesn't mean we cannot help these clients. We certainly can and we should. This just means we should not work within the scope of another profession's practice. We do this by referring our clients to their primary care physicians for proper diagnosis when needed. This will build confidence in the practice of massage therapy, not only by our clients, but also as a reputable healthcare profession recognized by other healthcare professionals. Therefore, in the assessment and application section of our SOAP notes, massage therapists will chart any information that took place during the massage therapy treatment. For example, what type of treatment did you perform? Did you treat the client with a relaxing Swedish massage? Perhaps you applied a few techniques that targeted the deeper tissues of the muscular system, such as cross-fiber techniques around the areas of concern, trigger point pressure release. Did you perform any Swedish gymnastics on your clients? For example, client received a Swedish full body massage with cross-fiber techniques targeting the rhomboids, performed trigger point pressure release on trigger point on right upper fibers of trapezius, performed light to moderate non-specific stretching of the cervical region, lateral flexion 3 times bilaterally, holding the position for 10 seconds. This would be considered application of the massage therapy treatment. How long was the massage? Did the client receive an hour or an hour and a half of a massage? How much time did you spend on the client's area of concern? What areas did you avoid? For example, client received a 60-minute full body massage with extra attention on their cervical and lumbar regions. Client requested to avoid their glutes and feet. What modalities were used during the treatment? Hot pack, cryotherapy, spa treatments, hot towels, hot stones, aromatherapy, and more specifically, what areas of the body did you apply these modalities and for how long? For example, client received a hot pack on their cervical region and their lower lumbar for 15 minutes. Client received hot towels on their feet prior to receiving a foot massage for 3 to 5 minutes. I checked in with the client twice to make sure temperatures were acceptable. What tools did you use during the treatment? For example, massage gun, massage roller, a scalp massager, or other massage tools, and to what areas of the body did you apply these tools and for how long? For example, client received a 10-minute application of the massage gun on hamstrings. Applied this application with light to moderate pressure. Client requested more pressure. However, I let the client know that it may be best to start off moderately and work our way up to heavier applications. Client understood. What types of oils, lotions, or creams did you use? Perhaps after you performed a relaxing massage with massage gel, you switched to a lotion or a cream for a few deeper techniques, since the lotion or cream allows for more friction when performing a specific stroke rather than gliding so easily. For example, apply deep tissue lotion for more friction in between cross-fiber techniques around the rhomboids. If the client had any accommodations that required you to alter the application of the massage, perhaps the client has a psoriasis flare-up on their elbow, but still requests for you to massage the area. You can then describe how you treated this area. For example, client requested I massage the entire arm. I informed the client that the massage gel may irritate the psoriasis further. I let the client know I could massage the entire arm over the sheet as to include the entire arm as a whole, but not irritate the psoriasis on the elbow any further. Client agreed to this accommodation. What changes occurred during the treatment? In other words, what was the client's response to treatment? Perhaps the client mentioned that their pain in their neck was significantly reduced, or their lower back felt much better after the hot pack. This would be a positive response to treatment and would be charted in the assessment application section of the SOAP notes. On the other hand, let's say that the client mentions that they still feel the same and the pain was the same in their neck and lower back. Then this would be considered a negative response to the treatment and would be charted in the assessment/application section of the SOAP notes. For example, I had a client who was having severe back spasms that would not allow the client to sleep at home. And as I was massaging the client in the prone position, the client fell asleep. But when I woke the client up to have the client flip over to the supine position for the rest of the massage, the client unfortunately had a terrible back spasm. By charting this negative response to treatment in the assessment/application section of our client's SOAP notes, I can look over this information prior to the client's next treatment and be sure to let the client know it may be wise to perform the entire massage face down or face up, depending on the client's preference, to hopefully avoid another back spasm when turning over. The next one is planning. Any plans going forward? In other words, what are the plans for the treatments going forward? What are the therapist's goals? Let's consider the client who had a stroke and now has right-sided weakness. The client's goal was to able to lift their right arm high enough to turn on and off the light switch at their home. The therapist's goal may then be to target the primary muscles that are responsible for abducting the shoulder, such as the supraspinatus deltoid, trapezius, and serratus anterior. Now let's consider another client-specific goal, the client who had lower lumbar pain mentioned earlier and needed a pillow behind their knees to fall asleep. This is subjective information that helps the therapist formulate a plan. Since the therapist understands that by placing a pillow underneath the client's knee, this is likely supporting the natural curve of the client's lumbar spine. The therapist can then begin to chart their plan to target the muscles near the spine, pelvis, and hip regions to help with any dysfunctions in these areas. What are the client's plans? If the client rebooks, you can add this information in your SOAP notes. For example, client rebooked for a massage next Saturday. If the client did not rebook but mentions they will call during the next week to rebook, you can mention this in the planning section of the SOAP notes as well. Client mentioned rebooking during the week. Perhaps the client wants to come in for bi-weekly or monthly sessions and they discuss this plan with you. You can also include this as well. Client mentioned rebooking for bi-weekly sessions. Will call back during the week to rebook. I have often had a client or two ask me how often they should come in for a massage, and I'm curious, what are your recommendations? Tell me down in the comments below. I will make a video with my answers soon, but I want to know what your recommendations for your clients would be. Any recommendations? What recommendations were given to the client? Did you educate the client on anything? For example, in the subjective portion of our client's SOAP notes, we charted, client mentioned they injured their back while gardening over the weekend. As they went to bend over to pick up the potting soil, they felt excruciating pain in their lower lumbar. They spent the rest of the day icing their lower back. Now, it isn't uncommon for us to want to help our clients, especially when it comes to educating our clients with simple modifications for safety. In this example, we would educate our clients with the proper techniques for lifting heavy objects. For example, educate a client on proper techniques for lifting heavy objects, such as bending at the hips and knees and squatting down to pick up the potting soil, and avoiding bending forward at the back to lift heavy objects. Self-care. For example, if a client has frequent tension in their neck, we could teach our clients a few self-massage techniques that we find helpful when we have tension in our cervical region. Homework. For example, any assignments or recommendations that we have our clients do when they are at home. This could be something as simple as writing down what activities that aggravate the pain throughout the day, or taking note of how they feel for the first few days after their massage versus how they feel a few days prior to their next massage, and any differences between the two. Now, it's very important that I mention we must be very careful when it comes to giving our clients homework. I'm all for educating our clients with healthy lifestyle practices. However, we must remember to stay in our lane. In other words, it may not be within the scope of practice for a massage therapist to prescribe a client a home exercise program with exercises or stretches to do at home. This would be considered overstepping our scope of practice. Now, keep in mind, this may be different for you depending on your state or local governing laws. Be sure that you are following your governing laws. For example, I've noticed that it has become common practice for massage therapists to list advised water in the planning section of their SOAP notes. I would argue that anytime we advise our clients to do something, we are prescribing. We are essentially saying that you should do this. It may sound something like this. You should drink plenty of water to help flush out the byproducts of the massage. Or you should drink plenty of water to help with soreness the next day. We must be very careful here because when we say you should, we are telling our clients what to do. We are prescribing our clients water. Now, let's say our client makes a post online and says that they just had a wonderful massage and they feel great. They also say that their massage therapist advised them to drink a lot of water to flush out the toxins. Fast forward, the client makes another post online that they ended up in the emergency room with water intoxication as a result of drinking too much water. And yes, this is a real condition. Although it is rare, it can still very much happen. I would encourage you to look this up. Now, this is an extreme. Is this likely to happen? I sure hope not. Can it happen? Yes. And if it were to happen, it may result in major liability. Now, this isn't to scare you, although I'm sure I already have. This is just to paint a picture of why it's important that we are careful when it comes to educating our clients and making any kind of recommendations. What I have found to be the most helpful, because let's be honest, we still want to help our clients, but how do we do this and stay in our lane? Well, it's very simple. We must change the way we say it. You and I statements. When I say, you should drink plenty of water, I am prescribing water. But when I say, I find it beneficial to drink water after massage, I am giving my clients feedback. I am no longer telling my clients what to do. I am telling my clients what I find helpful. With this feedback, the client now has autonomy. It is now the client's decision. It is now the client's choice whether they take my feedback and decide whether they want to drink water after their massage or not. We need to change the you to an I, meaning we are no longer telling our clients what to do. We are telling our clients what we find helpful, giving our clients the autonomy they deserve to make decisions over their own lives. Remember, you is advice, I is feedback. Now, in the client's SOAP notes, we can document the feedback in the planning portion of our client's SOAP notes as therapist feedback. I find it beneficial to drink water after a massage. I find that it's helpful with any soreness the next day. In direct quotations, meaning these were the exact words spoken by the therapist regarding what feedback was given to the client. Now, if you're wondering, why do we even have to do SOAP notes? I just want to massage my client. Well, number one, the most important reason for doing SOAP notes is it is required by law that all healthcare providers document every client's treatment session. Now, this may not be the case in your state if massage therapy is not regulated. Nonetheless, it is in mine. And as more and more people are recognizing the benefits of massage therapy is becoming an integral part of the public's healthcare. Therefore, I would argue that massage therapy's credibility as healthcare providers is likely to continue to change across the nation, which I, for one, am very excited to watch. Another reason is it is a requirement of most malpractice liability insurers that massage therapists have documentation on every one of their clients. It's important that we understand that SOAP notes are a legal document that could be reviewed in court in the rare event of one of our clients' cases going to court. So it's important that we make sure we are doing our very best to document our clients' treatment sessions thoroughly and correctly. In addition, SOAP notes serve as a communication method between different healthcare professionals. If you're planning or already implementing referrals, SOAP notes will serve as a key resource of information for communicating between different practitioners. Now, let's talk about a few frequent asked questions I often get when covering SOAP notes. Can doing SOAP notes save me from being sued? Okay, let me explain here. Our SOAP notes can serve as a piece of evidence as to what happened during the session in such a case. However, if it can be proven that we were negligent in the practice of massage therapy, then SOAP notes will not protect us. Now, if we were practicing within our scope of practice and we were treating our clients safely and we have the SOAP notes to back us up, then we should be all right. Therefore, it is important that we chart detailed information about our client's treatment, not unreasonably detailed information, just enough information that is important and related to the therapeutic massage. What if my client just wants a relaxing massage? Do I still need to do SOAP notes? If our client is an active and healthy individual with no pain or dysfunction and is only seeking massage therapy for relaxation, our client's SOAP notes will not need to be as extensive as if we were treating someone with pain or dysfunction in a particular area. The extensivity of our client's SOAP notes will depend on the intent of the massage. Do I need to do SOAP notes after every session? Yes, it's very important that we are charting detailed information concerning the therapeutic treatment of our clients. This gives the practitioner the ability to look over the client's SOAP notes before treating the client again. And if you work in a massage establishment where more than one therapist is likely to work with the same client, having SOAP notes gives the current treating therapist the ability to go over detailed information of previous treatments with this client. All important reasons to chart every session, even if it is a relaxing Swedish massage. Where can I get a SOAP note form? You can create one yourself. Just be sure that it meets the requirements for your state and local governing laws. More than likely, your client's SOAP notes will go on the back of the client's intake form or attached to them, depending on the standard of documentation that is implemented in your own practice or the rules and regulations of your state. You also have the option of looking online to buy SOAP note templates for massage therapists, where you can add your own logo directly to the template, download, and print them out. Also, if you look at our Etsy shop, you can find a few of our own SOAP note templates that we have created, as well as a digital form where you can type your SOAP notes instead of having to write them out by hand. This saves in time and paper waste and allows us to get back to doing what we love to do the most, massaging. If you're interested in purchasing a custom form that meets the requirements of your establishment or your governing laws and regulations, send me a direct message and I can help you out. Also, if you're still struggling with writing your SOAP notes, we have a SOAP note guide available in our Etsy shop that you can follow along as you are documenting your client's sessions. This should help guide you as you become more familiar with charting your client's treatment sessions. In conclusion, the more we learn and develop our skills, the sooner we will be recognized as reputable healthcare providers of massage therapy. Once again, make sure you are checking with your governing laws and regulations for massage therapy. They may not be the same as my state's governing laws. It is always the practitioner's responsibility for knowing the laws that govern their practice. Negligence of the law is no excuse, meaning even though you did not know the law and the law was broken, you would still be liable. Use the information learned in this video as an addition to your practice, not as a primary resource. Your primary resource of information would come directly from your state licensure laws that govern the practice of massage therapy. I will list a link in the description down below that has the massage therapy state licensing requirements for each 44 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. Now, if you are a student preparing for the MBLEx, make sure you know this information. Remember that the client assessment, reassessment, and treatment planning is worth 17% of the MBLEx, meaning that there is likely 17 out of 100 questions that may cover materials like this. I really hope that this helps you going forward. Y'all have a wonderful week ahead, and I will see y'all in the next video. Y'all take care.